Hello. First of all, congratulations. You know you're pregnant. Now, pregnancy causes a lot of physical and emotional turmoil in our life. This video will help you how to transition this turmoil easily into first trimester of pregnancy. Pregnancy is divided into 3 trimesters. It has a course of 40 weeks. So first 13 weeks is called as first trimester of pregnancy. This starts with the missed period, first day of your last missed period up to the end of 13 weeks. So the first symptom of pregnancy is missed period. Now missed period can be caused by a lot of things. One of them is pregnancy. So make sure your pregnancy is confirmed by your physician. Let's discuss in detail whatever symptoms you may have in your first trimester of pregnancy. The first and foremost most common symptom that 90% of the women have is nausea. Nausea mainly called as morning sickness. Why is morning sickness called specifically a morning sickness? Because a hormone called as human chorionic gonadotropin (HCG), which causes this nausea, is secreted in the morning hours of pregnancy. So the nausea that happens to the body is more in the morning hours. It may last throughout the day, but more common in the mornings. How to overcome this is by having high protein diet, 5 to 6 small snacks, and less sugary food. If you include more sugars, it will cause more nausea. So make sure you include less sugars in your diet. Next symptom is lower abdominal pain or cramps. Having lower abdominal pain, heaviness, cramps is normal in pregnancy, but excessive cramps is a warning sign. So to ease these cramps or to ease this pain, make sure you include some kind of physical activity in your routine like yoga, walking, meditation or something like that. The other symptom that you may face is constipation. Constipation happens because of the hormone called progesterone, which is high in pregnancy. This hormone lessens the movement of the bowel. The bowel is supposed to push the food forward, but this hormone lessens the movement of the bowel, because of which constipation occurs. Having a lot of fiber and ensuring proper hydration is the only way to get over this constipation in first trimester of pregnancy. Next is mood swings. Mood swings is the most ignored but most important symptom of pregnancy, first trimester of pregnancy. It is very, very common to get overwhelmed one day and get sad one day, get worried one day, get extremely happy one day. These are all mood swings, which is very, very common in pregnancy. First and foremost because of the hormonal changes that your body is undergoing, and second is because of the excitement of the pregnancy. Try to talk to your partner, try to talk to your family members about it. They will ward off this anxiety. They will take care of your discomfort what you're facing emotionally, and it will help your transition into pregnancy much, much better. The next thing what we can expect is weakness or leg cramps. It is perfectly normal for you to feel less of energy, weak, having leg cramps at the end of the day. This happens again due to the hormones which are changed in pregnancy. We can overcome this by ensuring a lot of hydration, which includes a simple lemonade with salt and sugar so that your electrolytes are normal, then a small banana to make sure that your magnesium levels are okay, and something including ragi or nachni in your diet so that your calcium levels are also okay. So this diet and some kind of physical activity will help to lessen the cramps and the leg pain that you may face. Next symptom is white discharge. Some kind of white discharge is normal in pregnancy. Of course, due to hormones, the amount of white discharge is going to increase. But if the white discharge turns into a yellow or green turbid discharge, if it starts smelling, then it indicates some kind of infection. That is the time when you have to consult your doctor for it. Next is breast tenderness. Some kind of breast tenderness is absolutely normal in pregnancy. Again, due to the increase in the hormones like progesterone, it is going to cause breast tenderness. The body has to prepare itself for the growing baby. You are going to feed the baby post delivery. So breasts have to take care of the baby. Hence, the growing breasts are also going to cause you breast tenderness. Next is pigmentation. Pigmentation over your cheeks and over your abdomen is normal in pregnancy. You can see a line going from the start of the abdomen till the end of the abdomen, which is called as linea nigra. This is absolutely normal in pregnancy. Once you deliver the child, 6 weeks after delivery, this pigmentation can disappear on its own. So nothing to worry about the pigmentation. Next is food cravings. Having certain food cravings is normal in pregnancy. Some may feel averted to some kind of food. Just the smell, just the sight of the food is very averting to the patient. So avoid the food which cause nausea, vomiting for you, and you can prefer the food which you are craving for. Just make sure that the source of the food is okay and the nutritional value of the food is fine. Next is sleep. Some patients experience excess sleep, some patients experience lack of sleep. Lack of sleep may be due to the anxiety, may be due to the emotional turmoil that you are undergoing. Make sure you include some kind of nutmeg in your diet. Just a pinch of nutmeg in warm milk at bedtime will ward off all these insomnia problems that you're facing. Excessive sleep is perfectly normal. Your body needs rest, your body needs time to recover, your body needs time to soak up the fact that you're pregnant. So sleeping excessively is perfectly normal in pregnancy. Don't get worried about it. Next is weight gain. It's okay to feel bloated because progesterone, which is increased in pregnancy, is going to cause water retention. Because of this water retention, you may feel bloated, you may feel heavy all the time. This is perfectly normal. How can we overcome this? Is having a lot of hydration and lot of fiber in our diet. Fiber and hydration will make sure that the bloating goes away and you feel better. It will not go off totally, but at least it will ease your pain of your discomfort and your pain.